Hi, I'm Jessica Dennee. I'm a registered nurse and a graduate student at Regis College in the BSN to DNP program with an emphasis in psychiatric mental health nursing practice. Making a lasting practice change in a complex system is a profound challenge that requires a systems thinking approach. One process framework that lends itself well to the demands presented by complex problems is ADDIE. In this presentation, the ADDIE framework will provide structure for the proposed examination of the complex issue of medical and psychiatric comorbidities, in this case focusing on a chronic condition, heart failure. The first phase of the ADDIE framework is assess. In this phase, the goal is to define the problem and establish a research question or the ultimate goals of the practice change project. Treating mental illness is a complex undertaking, as is the treatment of chronic conditions such as heart failure or diabetes. Both types of conditions are multifactorial and significantly affected by the patient's behavior and environment. When conditions such as these affect the same individual, some challenges appear to increase synergistically, resulting in very difficult treatment conditions. When a patient has both mood disorder and heart failure, the outcomes tend to be poorer overall for both disorders. Relationships such as these, as well as the troubling lack of access to mental health services, prompted the World Health Organization to recommend that health systems around the world move to integrate psychiatric care into primary care practice. This has the potential to save lives and improve the quality of life for many. Patients with mental illness have higher mortality rates, higher rates of cardiovascular disease, and increased use of medical care for both disease exacerbations and for instances of somatization of psychiatric symptoms. Rates of comorbidity between mental illness and heart failure are significant. Thus, improving the care for these patients may improve outcomes for both conditions for many individuals and reduce the burden on the healthcare system. To examine this issue, the following research question is proposed. Does the use of patient-reported outcome measures, or PROMs, as a means of assessing mental health status at each patient encounter to provide appropriate and timely intervention, reduce the number of emergency room visits for patients with comorbid heart failure and mood disorder? This complex question affects a number of actors and stakeholders in multiple environments through multiple actions, making the ADDIE framework particularly useful. Design, the second phase of the ADDIE framework, requires a review of the literature to determine what solutions others have used previously, whether related recommendations exist, and possible novel solutions. One tool that has been shown to be beneficial is the idea of a patient-reported outcome measure, or the PROMs, mentioned in the research question, a type of data collection tool which contributes to measurement-based care. The standardization and continual evaluation, the basis for measurement-based care, and the basis for many quality improvement projects in healthcare, is thought to improve the patient outcomes by revealing both the successes and the failures of treatment to inform the ongoing treatment. Large healthcare organizations, including the Joint Commission and the World Health Organization, have recommendations, even requirements, to use these tools in behavioral health care in particular. Many validated tools or inventories exist to focus on specific symptom profiles, including depression, anxiety, substance use, and many, many more. Develop, which is the third phase, will result in a well-organized, hopefully, and thorough plan supported by the evidence. This phase is particularly benefited by the overall structure of ADDIE. With defined goals, the process of solution and system development may be optimized through continual evaluation of the project. An additional methodology that can help organize the information revealed in the assessment and design phases of the process so that the develop phase can illustrate the actual workflow process, the resources required, the people affected, and so on, is a use case. This structure works well within the ADDIE framework to provide a mechanism to anticipate projects' potential challenges and opportunities. The proposed plan to tackle the current question of using the patient-reported outcome measures to help affect the outcomes for heart failure patients is addressed here in this use case, which we're calling the mental health assessment for CHF patients. A use case has a specific case ID, which always follows this format. We see here a description of the use case, discussing patients with comorbidities and how their outcomes can be affected by having this comorbidity. In this case, I've listed Denver Health Hospital and Clinics, which is the organization I currently work for as a registered nurse, as the primary actor, because they'll be the ones instituting the practice change. The supporting actors would be all of the people that work for the affected clinics and units within the hospital system. And then the main stakeholders are going to be the administrators of the institution, because they are the ones that are going to see the numbers change for the demand of emergency services. This question would require some preconditions, including patient history within the electronic medical record, the staff being trained to use the inventories and to evaluate them, developing targeted education interventions that are effective. And this is going to describe the normal flow of events, which we'll see in a workflow diagram in the next slide. And then also we're defining here the success end conditions and the failure end conditions, where the success would be defined by having the patients be correctly identified as having this comorbidity, patients that were actually having difficulty adhering to the recommendations because of their mental health status, that they are in particular identified, and that the effective education is able to be incorporated into care plans and is effective for the patients. A failure in condition would be that the patients aren't identified, that results aren't documented correctly, that the providers aren't actually evaluating the results of the measures, and that the intervention fails to affect the behavior or the mental status of the patient or the medical condition. And then we talk here about the trigger, what would cause this normal flow of events to evolve. Here's a workflow diagram of the implementation. The fourth phase is the actual implementation of the proposed solution. This presentation is limited by being a proposal, but this workflow diagram represents the pilot implementation of the practice change intended to address the proposed research question. The fifth phase of ADDIE framework evaluates the results of the implementation and allows for this analysis and feedback to inform the repeated iterations within the ADDIE framework, cycling back through the various phases to rework the assessment, design, development, or implementation as needed until the goals are reached or there is a satisfactory result. In this case, we've defined a problem, determined the strategies to address the problem, anticipated some challenges, created a workflow, and provided a mechanism to continually evaluate and reevaluate the results as the iterations proceed. The use case revealed several resources and conditions that would be necessary to bring this proposal to fruition, including the importance of a strong intervention for identified patients, of functioning relationships between providers, and the technological mechanism needed for record keeping and for data sharing. Some issues that would be particularly benefited from the iterative evaluation are the specific assessment tools used to gather the patient information, reviewing the effectiveness of and any new evidence of post-identification interventions that might be used, and consideration of which particular disorders may be the most impacted by the proposed practice change. The success of the project, how well the goal of improved outcomes for patients and reduced burden on the healthcare system, as evidenced by a reduction in emergency room visits, should be evaluated at predetermined points, including 1 month, 3 months, and every 3 months following for up to 2 years. Additional evaluation of frontline staff experience and compliance may also inform the iterative development of attempting to modify a complex system in a complex system, a complex set of problems in a complex system with some amount of certainty as to the result, which is, after all, the goal of a practice change. Thank you for watching this presentation. Here are 2 slides of my references. Hopefully that was informative both about proposed practice change that I'll be working on, and also about the ADDIE framework itself and use case, how those methodologies are beneficial. Thank you.